Sawadika. Good afternoon, everyone, and welcome to yet another Facebook Live session hosted by Esperance Integrative Cancer Clinic, a subsidiary of Bumrungrad International Hospital, where we give confidence to manage your challenge. As your guide for today, my name is Mira Mazahim, and I'm here to help you navigate through this informative experience. So, as for today, we're stepping into a world where health meets innovations. So, we're here to uncover a game changing aspect of medical science, where our main focus for today will be all about whole body hyperthermia. So, this innovative approach has caught the attention of experts around the world for its potential health benefits, as well as the insights into how our bodies respond. So, without further ado, please allow me to introduce you to our special guest for today, who will be joining me and who is also a specialist in naturopathic cancer medicine at Esperance Integrative Cancer Clinic. He will be providing us with the information we need with today's topic of how does whole body hyperthermia benefits our health. So please welcome Dr. Brian Kunakom. สวัสดีค่ะ
สวัสดีครับสวัสดีครับ
How are
Thank you
you
so much
today?
for the warm welcome.
You're welcome. So are you ready?
I guess as ready as I can be.
Okay, so first things first, as some of our audience here may not be familiar with the term whole body hyperthermia, could you please start off by explaining its concept and also like define its significance as a technology in the field of therapy?
Okay. So let's start with the word hypothermia on its own. The word hyper means a lot, right? Thermia means temperature. So when you put these two words together, it means a lot of temperature. And it's a type of treatment where we use temperature, which in this case would be heat. The next thing that we should talk about is local versus whole. Local means that we find a particular area where we induce heat to the body. That would be local hypothermia. But whole body hypothermia means that we are generating a systemic effect, kind of like a fever, right? Actually, it is a fever. So we're inducing a fever, which a fever is our natural body response whenever our immune system needs to work a little bit harder. So to put all these terms together, what it means is increasing the temperature, giving a lot of temperature to the whole body. So that's what it means.
Right.
Yes.
And considering like advancement in therapy here, what specific impact does whole body hyperthermia have on treatment approaches and maybe medical progress?
So it actually is a good add-on or adjunctive care. It probably wouldn't be the main treatment for anything, we would say. Like, it's not one of those things where I have this condition, therefore I have to do this treatment right away. So hypothermia is not meant for that. It means if you're doing some other treatment, if you do whole body hypothermia, we're inducing a fever to you. Therefore, it should make your body work a little bit harder. So with a fever, let's talk about a fever so that we understand things a little bit better. When we induce a fever, we're making the blood flow a lot more than usual. So we're inducing things to move around. Then your immune system starts becoming more active. Once the immune system becomes more active, we are able to start getting that immune system into areas where we couldn't have done it when there's no fever. Let's say, for example, if your white blood cells is supposed to go into small areas of the brain, but because there's no need to, they just sit around there, they don't go to the brain. But with a little bit of temperature, now everything is active, there's more pressure, blood pressure goes up, heart rate goes up, then now you get these white blood cells going into the brain and it fixes things. Sort of inducing inflammation. Inflammation sometimes is known as something bad all the time, so we try to like put it on hold. But that's how our body responds to things. If you're inflamed, it means that your body is damaged in one way or another, and your body is trying to fix things. They fix things through inflammation, bringing in white blood cell where you start getting a full of blood, you get swelling, right? Because it's fixing, and that's what the temperature is doing. But in this case, when you're inducing a fever in someone who doesn't need one, then now you get, you kind of tell the immune system, you should be on alert for some reason. And the body starts responding with, okay, let's start working, let's get to work. So now it starts going all over the body looking for things. If there's nothing, great, right? You just get this metabolism. Your muscles start working too because your muscles want to get rid of the heat, right? So now you start sweating, you start doing detox. So let's say if there's nothing wrong with you, you end up doing detox. You start burning calories, right? If your muscles are always pumping blood, then you're going to be you're going to start burning calories just the way that you would do with exercise. Not strength training, but more of a cardio side, zone 2, zone 3 at most. And then and then the after effect is you lose a little bit of weight because of the water. You sweat out all the toxins. So that's in a nutshell. Medically, I use it for my cancer patients because I know that heat induces the white blood cell to work a little bit harder. A lot of times our immune cells get lazy because we train it to be lazy. We like to eat whatever we want. We tell our white blood cells to not do anything. So with a little bit of heat, now we get into a mechanism where it's like, let's be on alert, let's get rid of things. So that's what we use the whole body hypothermia for in this case.
So you would say that it worked both for therapy and for medical, how do I say, in medical field as well?
Yeah, so we would use it in both wellness and clinical setting. I prefer this treatment to be used in a clinical setting more because when you induce a fever, it doesn't feel great. You've had a fever before. When you spike up a fever, people never feel good. And sometimes you might see things that might look like a complication. But it can be used in a wellness setting as well. It's just that people don't enjoy it as much.
Right. So while we explore this approach effectiveness, are there any like side effects that we can identify that is associated with this usage?
Of course, everything we do has side effects, right?
Yes.
We're using infrared to induce heat. So the first side effect we're talking about is infrared can actually burn you if there's too much heat. If they're at the areas of the skin where it's kind of thin, then burning sensation can happen. The other part is too much sweat is not a good thing because you start dehydrating yourself. The other thing is if a person already has blood clots in their leg, let's say, for example, it's just like exercising. If they have a blood clot in their calf muscle, and they go to exercise, there's a chance that we can launch that blood clot all the way to the brain, causing a stroke. We can launch the blood clot into the heart, causing a heart attack. So those are the contraindications. We wouldn't want to work on patients that have blood clots. We would rule them out first. But the sweating and everything, that could be fixed. We constantly give our patients water during the process. When there's too much heat, we cover them up so that the infrared doesn't burn them. So those are the side effects we're talking about. Other than that, not really. Just feeling not great.
Right. So you would say it's a little bit uncomfortable throughout the process.
I wouldn't say a little. I wouldn't say a little. It's quite uncomfortable. It's like one of those things where you really put your body to work. When you put your body to work, it's never comfortable. When you exercise, it's not really. If you're exercising and it's comfortable, then there's something wrong with your exercise, right? You're not going to gain much from it. Usually, when you exercise, you want to be feeling terrible a little bit to be able to gain muscle mass, to be able to gain that fitness level. But if you're just going for just, hey, I'm just doing cardio at zone 1. Zone 1 means that your heart rate doesn't go up that high, and it's just a walk in the park, then we're not really exercising. We're not really stressing the body out too much. The whole idea about doing this treatment is that we stress out the body so that the body creates a response so that it becomes more alert.
Yes. So since this approach can be useful in the treatment of patients, I'm curious to know that if whole body hyperthermia also play a role in contributing to like stimulating the immune system for all patients.
Absolutely. I actually did this firsthand. I went ahead and did a blood test myself to look at my immune system. I really wanted to know what happened. So what I did was I did one before treatment, I did one right after treatment, and I did one 48 hours after treatment. And now I'm deciding if I want to do it 2 weeks after treatment because it's interesting to know what the immune system looks like. Cost does add up, right, when you do those kind of blood tests, but you don't have to do that blood test. In a nutshell, you can actually see that the immune system is a little bit stimulated. Even in a person like me who doesn't have cancer, the immune system works a little bit better. Specifically something called the NK cell or natural killer cell. The activity of them increased by a little bit. It increased within 3 hours, which we would achieve that same result with the same increase with giving our patients some oral treatment, right? Some supplemental treatment in 3 months. So we kind of shorten the timeline and give them that boost of immune system surveillance within 3 hours compared to 3 months. So yeah, anyone can do it, except for people who are really, really weak and they can't really withstand heat that much.
Right. So you were mentioning that you also did it yourself, right? Could you share a little bit more about how was your experience and everything involved?
Oh, I actually prepared some pictures of me, right? So let me try sharing that. Let's bring that up into the screen. So since we're talking about that, let's talk about the process, right?
Yes,
So what this is that this is a whole body hypothermia machine. We have these 4 infrared lights that produces infrared light A. And that's a specific wavelength that will not burn you. And we're targeting just the torso. As you can see, I circled the torso because that's the most area you would get on the body. And that's how we would start heating the circulation. Inside that bed is actually only 38 degrees Celsius at most. But it was able to heat up my temperature all the way to 39 degrees Celsius. But anyways, in the first phase, we go in, we get the lights on, we sit there until the temperature goes up to a certain point, right? Once the temperature goes up to a certain point, then we turn off the lights, and this is where the magic happens. We turn off the lights. This is just for you to see that my temperature went up to 38.5 degrees Celsius. Usually our body is at 37 degrees Celsius at most. My body is actually at 36.3 degrees Celsius. And the way to measure core body temperature is not from the forehead, it's not from the armpit, it's actually from the rectum or the butthole. Another word for that. And you can see why it fluctuates, why we need to use the rectum. Because you can see T1 is 38.5, T2 is 34.5. That's my skin temperature. I measure it at the forehead, I measure it at my armpit, it's around 34 degrees Celsius most of the time. But with T1, you can see that that's the rectal temperature, that's the core body temperature. So I induced a fever. After I got to 38.5, they stopped the machine, closed down the tent, right? So that it insulates me. And now this is where the magic happens. Now the body's like, okay, we have to deal with this heat. What do we do next? The white blood cell starts working harder than usual. Then the temperature goes up a little bit more. When the temperature goes up a little bit more, then it doesn't feel that great. The face starts turning red. And then eventually you start to feel a little bit tired. And then afterwards you feel really relaxed. And after we're done with the tent for 1 hour, I think my temperature went up to 39. And then we stopped the treatment. We stopped the treatment when we have a fever. But I cooled down really fast. I took a shower, and that's pretty much the end of the treatment. Yeah. And you can close down the slides now.
So it's pretty quick in a way.
No, it's the whole process took me 3 hours, right?
Oh,
So
3 hours?
if you're fit, if you're a person who runs all the time, who does cardio, and I've recently been training a lot with my runs because I'm trying to push to become an athlete.
Yes.
Still far from it, but my fitness level went up. So in the first process, when you're heating things up, this first process, usually it takes less than an hour to get to 38.5 degrees Celsius. But for me, it took me more than an hour and a half to get there. Because the body is so good at releasing heat, so it does whatever it has to. Skin just keeps sweating, your muscles starts moving, so heat's being released faster, so it's harder to bring up the heat. Versus a person who's like smaller or someone who's not that fit, they can bring up the temperature within less than an hour sometimes. Someone with lower muscle mass tends to have that effect, so it's a lot faster for them. If we're bringing athletes in, the the longer you're in there, the more fit you are usually in terms of cardio.
Right, and how's what do you think about the whole experience for yourself? What do you like them, or do you any parts that you like dislike or feel uncomfortable?
Honestly, I think I want to buy one for my home.
Wow.
I actually was thinking, if my patients don't want to do this, I'll do this myself. Like, honestly, I see the benefit of it in terms of the immune system. And I think in terms of cancer, we're talking about cancer. Cancer is a disease where our immune system is lessened. And we've been taught over and over again that cancer is being caused by chance. It's not caused by chance. It's being caused because we don't take care of our body. And the problem that we see is that we do not assess immune system as a standard protocol. And I understand why, because if you increase the immune system, we can't do it through drugs. And there's no drugs that would specifically increase the number of cells. We have drugs to increase the effects of cells, but that doesn't require blood testing, right? But when you're testing these things, it's more out of my own, well, for me, in my case, it's out of my own interest. If it's for my patients, I'm aiming for a goal for them. And most of the time for my patients, if their immune system is low, most likely it's hard to fight their cancer. When their cancer when they get chemotherapy, and their immune system gets better, then we see that their prognosis is better. So we see that same pattern. So when I put this information into a normal person like myself, I do realize that, so if your immune system is low, the increased risk of cancer happens. So I find that if you don't protect your immune system, then really there's nothing we could do, and we just tell ourselves that, I just have bad luck. No, you don't have bad luck. Look at your diet. Do you exercise, right? Do you do things to make sure your immune system is in check? How do you actually know? Now we can check. And this is what I do. Do you sleep at night? What's your HRV? Things like this. How's your recovery? And so I think these are the important things, and the reason why I'm very close to having one inside my house. The only reason why I don't is because nobody will help me operate it.
So it takes more than one person to like do the process?
Well, you need to zip yourself in, right? And you have to position yourself in. And when you're sick, if you remember yourself getting the flu or COVID, you want someone to take care of you. Right?
Yeah, for sure.
You need someone to let's wipe you down a little bit. You need water, things like this. But if you're there alone, then it can get pretty scary, right? Because there's no water. You're stuck inside. You can open at any time, but at the same time, it doesn't feel great. For me, I do notice that when my temperature goes up, and this is something that I see in med school a lot, is that as a student, I saw that my patients started having numbness, tingling, because their blood pressure goes up, their heart rate goes up when their temperature goes up. And I always wonder why this is. It happened while I was in the whole-body hypothermia. I was like, this is what it feels like, because my temperature and my blood pressure is going up, so it's putting pressure on my nerves, and then my jaw started going numb a little bit. So in that scenario, you want someone to take care of you. So don't do it alone. That's why I said clinical setting is great. That's probably one of the biggest reasons why I haven't bought one for my house.
Wow. So it's I wouldn't say it's scary. I mean, it would be scary, but not too dangerous.
Not too dangerous. Yeah, if you have someone taking care of you, and as you can see in the picture, I'm being monitored the whole time, right?
Yes.
You can see that there's an EKG stuck onto me. There's my heart rate that's being checked. There's also my oxygen saturation to make sure that I'm breathing okay. You can see that my respiratory rate increased. You can see all the parameters out there. When you're alone, you can't really see it. Yeah.
Right. And you were mentioning about cancer patient. So how does whole body hyperthermia complements the traditional cancer treatments like chemotherapy or radiation therapy? Like, what benefits does it provide when combined with all these procedures?
Okay. So the first thing that we see is that it helps stimulate the immune system. The second we see is that there's an antidepressive effect, right? Cancer patients who undergo chemotherapy, you do see that they start getting a little bit depressed. With heat, we see it even with just gentle heat, such as a sauna as a naturopathic doctor, people talk about constitutional hypothermia, which we use like heat pads. That feels a little bit good. So there's that antidepressive effect that happens at the level of the brain. And it also helps with stimulating white blood cells. If you have low white blood count, within 3 hours, my white blood count increases by 30%. It was 6,000 and went up to 7,200. There's that quick stimulation that happens. And that happens with a fever, but we're pushing the limit of the fever a little bit more. So someone who's been going through treatments, they would start to stimulate themselves with the immune system. And then now the immune system, in combination with whatever treatment, we're moving towards immunotherapy these days. Like, for example, lung cancer, there's a certain drug called PD-1 inhibitor, which blocks the PD-1 receptor of the T cell, so that the cancer cells could not fake themselves as normal cells. So sometimes they trick the immune system into thinking that we're part of you, so stop killing us. So now when your immune system's on surveillance, plus this drug, then you have that extra effect, right? The drug can only work as much as how much immune system you have. If your immune system is low, you put this drug in, you're technically blocking nothing. But with this increase in immune cells, of T cells, you're able to increase an army that eventually can fight the cancer. So it works hand in hand pretty well, and we have a protocol for that. Just to get even deep down into what it does, it works at 2 levels. One, the heat can actually stress out the tumor cell. Because keep in mind, our body temperature has increased. Keep in mind that is happening, right? Our body temperature is relaxed around 36, 37 degrees Celsius. Now, cancer cells are relaxed at that point too. Now imagine we induce heat all of a sudden, right? We induce heat, now your temperature goes up to 39, 40 degrees Celsius. The cancer cells don't like that. They don't like that temperature increase either. So now they start stimulating something called heat shock protein. Heat shock protein is being produced so that cancer cells protect themselves from heat. Now, the heat shock protein specifically that's being produced in this case is called MICA or MICA. MICA directly creates a signal to say, eat me, to the immune system, and the immune system comes in and eats it right away. So cancer protects itself, but in that process tells the immune system to eat it. So that's one process. The other process is, even without the tumor cell being there, let's say there's no tumor at all, the immune cells, we have T cells that are kind of not mature. We call it naive T cell. They haven't grown into what they're supposed to do yet. Now they get alerted by heat. So now they mature, and all of a sudden now they start attacking things that they're supposed to attack, such as viruses or old cells that have been living there for a while. We call it senescent cells sometimes. And we talk about this in anti-aging all the time, or longevity medicine all the time, that senescent cells, they are basically old cells that do nothing. And the reason why they do nothing is because they have the tendency to become cancer, but the cells, they said, I don't want to become cancer, let's make them old and make them stay there. And they just stay there. So to be able to get rid of them, you actually need the immune system to get rid of them. And that's where heat is able to get rid of them there, right? Without this heat, then they just sit there forever. And if they sit there and there's another mutation, let's just say something happens, like radiation happens, because we go onto a plane, right? And yeah, being on a plane actually has a little radiation too, FYI. For people opting out of CT scans but are still flying all the time, I'm telling you, you're getting radiation at the same time. Let's say that senescent cells there, old cells are there. Now it gets like this mutation, it can turn to cancer as well, right? But our immune system, if it, in response to heat, starts becoming active, finds these cells, get rid of it, and we see it over and over again that longevity experts keep saying that our immune system is the reason why these senescent cells can be destroyed. And we see it in studies as well. And let's just say one of a good example would be a cyst, right? Sometimes you have a benign cyst. They're not cancerous. They're not malignant. They're benign. They don't do anything, but they can develop into cancer. That's because they have a property of some senescent cells in it. Can you get rid of it? A lot of people say, why? The only way is to do surgery. But I do have a theory. If the immune system can get to it, then theoretically, we can get rid of it. Unfortunately, I work with cancer patients, so I don't get to see cysts being reversed. But if someone else does have experience in this, I would love to talk to them too. But theoretically, it sounds about right. But in terms of cancer cells, the immune cells eating the cancer cells, we see that happening with heat. And that is one of the oldest therapy we have used in the olden days. That's way before we actually started using radiotherapy. We use hypothermia, heat through fire, or sometimes water heat, which is still hypothermia. But now, ever since we were able to split an atom, create radiation, then radiation became the next best thing. So that's how it works.
All right. And what about for those patients where they are experiencing pain in their body? Are there any relationship between whole body hyperthermia and pain relief? Like, what are the evidence that could support its effectiveness in order to like reduce pain among patients?
So usually with heat, you're able to reduce pain anyways. And we see this again and again. A good example, I don't know this, but women would know best, right? When they get menstrual cramps, the first thing that I see most of the time is we use a hot pad, right? Or a hot bottle. Yes. And that tends to relieve the pain. So the mechanism behind it is we want to increase more blood flow to the area, because sometimes there's a shortage of blood flow, making things hurt a little bit more, and cramping does happen. The same idea does happen with heat in this case, but heat in this case would be throughout the whole body, right? And that's how we are able to decrease bone pain. And as I said, if there's inflammation, you're able to resolve the inflammation faster with this whole body hypothermia, because we're using heat systemically. Inflammation is not always a good thing, but clearing inflammation by your body is a good thing. So if you're already having inflammation and you're using heat to clear things up, even better, right? Yes. A lot of doctors would just say, go with an anti-inflammatory, take one pill, done, right? That's one way. Yes. Another way would be trying to induce heat. And we also see it among sports players too. You relax the muscle a little bit more so that they can reduce pain, right? Obviously not during the icing process, right? If you're using icing, you probably don't want to use heat. If you're having swelling, you probably don't want to use heat, right? You want to give it a few days, then you use heat.
And given the focus on pain reduction here, as well as the patients in terms of their engagement for detoxification that you mentioned earlier, for like treatment support and to improve wellness, how does whole body hyperthermia influence and contribute to the detox process during like patients' treatment?
So in terms of infrared sauna, we have seen a lot of benefits from it. And a lot of people have told me, I don't need your whole body hypothermia, I can do infrared sauna. I was like, you've never done whole body hypothermia. And I'll tell you why. Because when you're in an infrared sauna, you can walk out of that room anytime you want. In a whole body hypothermia, you're stuck there. So let's just say you're in infrared sauna, the light shines on you. The idea is that you get the infrared to shine on you so that your body can start sweating, yes. Releasing toxins, right? And these are the benefits of sauna, an infrared sauna. And we've seen it on Instagram with influencers talking about saunas every single day these days, which is a good thing. But I'm telling you, it's different. That's mild hypothermia. Super mild because you can walk out anytime. Not being controlled. If you push yourself, you can actually pass out in an infrared sauna, right? So if you don't pass out, then here are the benefits. You have increase of blood circulation. You decrease in sore muscles, right? You start relaxing. It improves your sleep. It increases your fitness level. It also helps excrete heavy metals through sweat. Now, imagine this is an infrared sauna where light is being shined upon your whole body not to a specific region. It's just being shined throughout the whole room. And we don't even know where light is placed sometimes in some infrared sauna. This one, you got like 4 electrodes right on you, 30 centimeters away. You can't be more controlled than that, right? 30 centimeters away from your body, and infrared is always shining. The spectrum at which you're getting is infrared A all the time. Compared to these infrared saunas, you don't even know what spectrum is at. It gives you a range, right? And it's not at exactly 90 degrees to the body. If it's not 90 degrees of body, it's not maximum effect of a sauna machine, right? So now we're looking at an upgraded version of an infrared sauna because you're stuck there and there's no way of getting out. You're going to be releasing more heavy metals for sure. You're going to be releasing more sweat. So in terms of detox, you're getting those, plus your immune system also fighting everything for your body. But an infrared sauna, when you sit in there, if you don't sit in there long enough, you probably won't get that immune system effect unless you do it every single day. And you'll see that people have to do it like 40 minutes at a time before they see the same benefit. And even if they say it's the same benefit, I would love to do this test where I take my immune system, test it, go into an infrared sauna, come out, test it again. I can assure you, effect is not the same. The other part to the whole body hypothermia, what I found amazing is that when I took my blood before, it was dark red.
Yes.
After the treatment, my blood was bright red. Usually that happens if it's oxygenated. I see it doing ozone treatment. I would see people get more bright red blood. But now that's only a certain amount that we pull out to put ozone in, right? That treatment. But imagine this is your whole body. No matter where you take the blood out, it's bright red. So I've never tested oxygenation, but from the color, I think you can't get that from an infrared sauna alone. So yeah, that's all the benefit you get on top of the detox and immune system.
So what if like some patients does not prefer to do like a whole body hyperthermia, and they would want to go for like my hyperthermia here? Would you suggest which way would you suggest them to choose?
If you're trying to just excrete heavy metals through sweat, or just to feel relaxed, then a mild version would be more well suited towards that person.
Yes.
But if you're trying to go for immune system effect, a reset of the body, trying to get rid of inflammation, right? That's currently happening in the body. Then I would not use the infrared sauna for that purpose, because you might not get that effect.
Right. And were you saying something? Sorry.
Oh, I was thinking of actually adding in on the depression side, because I found this study that was pretty useful. They actually did a study comparing placebo to whole body hypothermia for patients with major depressive disorder, and this is only through just one treatment, right? The process is the same. They use the exact same machine. I feel bad for the placebo group because they were just getting heat, but they weren't really getting the whole body hypothermia treatment. But the whole body hypothermia treatment, you can see that there's an improvement in their depression score with just one single treatment. And what they did was they look at the score every single week. And it's not that we give these questionnaire to the patient to just put a checklist. The clinician have to sit with these people in the study and have them score, so that they won't know what they scored before, and it won't be a bias, right? And it turns out that when you look at the two groups, you can see that the word sham means placebo. The other group would be the whole body hypothermia. You can see that in both groups, their depression score decreases significantly, but more so in the whole body hypothermia. Why does it increase in the placebo group too? Is because probably of the heat effect. I think heat in general would be able to induce some antidepressive effect right there. And you can see that they just got one treatment and there is no relapse. There's no increase in the in the score at any point in the next 6 weeks, right? So now the question becomes, okay, can it be used instead of an depressant. And I was like, probably not, right? It could be used on top of an antidepressant. And this is a pretty good data to show that just one treatment, pretty effective. And it turns out that the participants found the experience to be pleasant when they're in the whole body hypothermia machine. So it's not as bad as the way I describe it, but I wouldn't say it is a walk in the park. I mean, it is some of stress, but at the same time, after the treatment, you do feel relieved and relaxed.
Yes, and you mentioned that you're kind of stuck in there and you can't get out. Is there no way out at all? Like you cannot take a break from it? Like you just have to go through it like for the whole entire process?
Well, if you leave, then it's pretty much done, right? You can
Yes.
always abort the treatment at any time. If, like, for example, you're not feeling well and you just want it to stop, we can just turn off the machine and it's done.
Right.
It's not like, and if you're heating up and you turn off the machine, you open up the tent, then you're going to cool down pretty quickly because your body wants to cool down. You don't have an actual fever from an infection. We're inducing a fever. Therefore, a way to induce is, one, we have to add the heat. Two, we have to insulate, right? And the moment we stop insulating, then you feel better right away. And that's the effect when they opened a tent, it was like, oh my God, cool air, feels so great. So yeah, you can abort the treatment at any time. It doesn't have to be like the whole time. And it's not like the patient will have side effects for the rest of their life. It's one of those things where if you stop, everything's done, right? And you can't go back in and say, I want to reheat myself because the whole 3 hours would start again. Right.
Right,
Once
but
it's done, it's done.
so but you would not get the same benefits for like if you stop halfway, you won't get the same benefits as if you go full way.
Of course, yes. You'll probably get the same effect as a mild hypothermia, so the same as
Yes.
a sauna, but not the full effect of what I talked about with the immune system stimulation, with the oxygenation of blood all of a sudden increasing.
Right. And what about those individuals who are considering this approach of treatment? Could you outline how the procedure is initiated, or like how can the patients or those people like prepare themselves to get the treatment?
So first, stay really hydrated, right? It's as if you're going for a run, a marathon run. You're going for a race. Think of it that way. If you're going for a race, you wouldn't be not sleeping all night long. You want to be well rested. You want to make sure that you're well fed, and then enough water. Right before your run, you probably wouldn't eat a large meal and go run right away, right? You would probably leave 2 hours apart. So same thing with this. You would leave 2 hours apart, no big meals. You can drink water if you want. They'll change you into clothes. They'll put on monitors for you. Then have you lay down in the tent that I showed you earlier.
Yes.
This tent with the light on. And then you'll just lay there, pretty much. And if you need water, you can always ask for water. Well, the nurses will bring the water in. I myself might bring the water in if I happen to walk by, and check on people from time to time. Then once we get a temperature that we want, we stop the lights, we close the tent, right? Then we have them stay in the tent for 1 hour to let the immune system do its job a little bit. Then after that, we open the tent and then we cool you down, give you more water, make you feel a little bit more comfortable. And then after that, you can go for a shower. And then that's pretty much done.
So basically, like doctors and medical staff will always be there to support their patients while receiving the treatment. And what about like during and after the process, like throughout their recovery sessions?
We'll be here. We'll be here to make sure that everything is safe, no complications happen. And during the uncomfortable process, if you need more time to rest, we won't rush you. You can just sit there, lay down for a while until you're comfortable. And
All
we're
right.
always having someone to monitor it all the time. And after you're done with the treatment, we'll show you what your graph looks like. Your temperature graph goes up and it comes down, right? We'll show you what that looks like.
All right, and last questions from me. So, is whole body hyperthermia here is available as a treatment options for all patients, or are there any specific criteria that it's suitable for different cases?
So it's suitable for all types of patients, even patients who do not have any illness. Actually, we prefer people without any illness so that they don't feel too weak, right?
Yes.
Athletes, if you want to challenge yourself, if you've already been doing ice bath, cryo, right? That's the extreme cold. This is extreme hot, right? This is challenging the other extreme end. And there's actually a study that talks about doing this process allows you to withstand heat stroke a lot better. So runners who run in hot countries are able to release heat a lot better, and their fitness level also increased. There's actually a study on that. But there's actually for people who do have health conditions such as heart health, right, cardiovascular problem, we might have to go through a consultation and talk to you a little bit to make sure that's safe for you. If you have blood clots, again, we want to make sure that those blood clots are stable, not the ones that just happen and can launch anytime. Other than that, we're not too. Oh, and if you have a wound, if you just have a large wound, I wouldn't recommend you coming in because you'll be sweating a lot. If you're
Yes.
getting stitches, those stitches can get wet. So make sure that you don't have an open wound, not new open wounds. Okay.
All right. Thank you so much for answering my questions. This was very useful and very knowledgeable. Now we're going to move on to the Q&A sessions where our audience will be able to ask you some questions. And I think they already have been asking since the beginning. So the first questions, does hyperthermia has any bedside for summer country?
Has any bedside for summer country? I'm not quite sure what this means.
Maybe bad side effects
Oh,
for hot
bad
country?
side effects. Okay. Side effects, right?
Yes.
Um, so if you're in a hot country, we're in Thailand, we're in Bangkok, super hot, all one temperature all year round, right? But we're doing this in an air conditioned room. We're not doing this outdoors, right? So if you're in the Middle East and it's hot outside, obviously during the process you have to cool down first, take a shower, then your body temperature would be normal again before you can walk out. This is not an outdoor treatment, so don't worry. There's no side effect on top of what I already mentioned earlier, which, like I said, a fever would make you feel tired. You can get
Yes.
dehydrated because of the loss of water. So we have to constantly give you water. You can also start feeling what I felt. Nobody else had this problem except for me so far that I've seen among my patients, which is the numbness in my hands and feet and the jaw.
Yes.
Um, uh, that's some extra thing I wanted to add because that happened to me. I asked a lot of the specialists around the world, especially in Germany, even the owner of the machine, Heckle. They did not come across that either, that they said I was the first to say that. So that's just the extra side effect that we talked about. Other than that, not really. And once we're done with the heat, the side effect goes away.
All right. And another question is, how would you recommend for people who usually do cryo chamber and HBOT once a week for longevity already? How do you put hyperthermia in the program?
Okay. So this is yeah, thank you, Dr. Fa, for asking this question. I actually had the same question when I read about whole body hypothermia, and I finally have an answer for that. So for cryo, right, you wouldn't be doing it on the same day as whole body hypothermia. You would do it on a different day. With cold, you don't want to do it at the same time. You want to leave like I would do it a different day. Some people, they wanted to do it right away. I wouldn't recommend that because the quick change in temperature is not really a good thing. The idea behind heating someone up is that they can cool down themselves. If you cool them extra, then that's probably going to push it in the other direction. With HBOT can be done on the same day as well as on the same day as whole body hypothermia, because usually that means that we're doing hyperbaric. I actually thought about this where when I was gonna buy this machine for my house, I was thinking of whether or not I could put this machine inside a hyperbaric so I can get both effects of hyperbaric and also the heat, right? But the answer is we can do it one treatment first, then followed by another one. The order doesn't really matter, but I think a hyperbaric can be done, would be more useful if we do it on a separate day, because I think we're already getting an oxygenation of blood increase in the whole body hypothermia already. So there's really no need to do ozone or hyperbaric on the same day. With whole body hypothermia, we can't do this every day. We usually try to go with my cancer patients, if we're going for results, then once a week is something I'm looking at. But sometimes I even think about once a month, because it's quite tiring. For regular people, I think once a month is great. I wouldn't go over once every 2 weeks. I think that's kind of pushing it, but once a month would be great. For those of you who are like, oh, I don't want to do just one because it's not going to work, I can tell you, just after one treatment, even in the study with major depressive disorder, just one treatment and you'll see it right away that you see that there's going to be some benefit to it. Oxygenate, it's like doing ozone once, right? I've seen a lot of patients do that. So if you're worried about doing this once and not getting the same effect, then you should also be worried that when you do ozone once, you're just getting 100 or at most 200 milliliters of blood being oxygenated, versus this one, you get the whole body oxygenated. So yeah, once a month, or at most twice a month, I would go for regular people. How do you put hypothermia into the program? Yep, okay. How many days before or after cryo? So cryo can actually be on a different day, just 24 hours later. I read somewhere that with the increased oxygen, when you do cold, you're able to circulate the oxygen better to the other parts of the organs and stimulate the longevity effect a lot better, and also the detox effect as well. I think this is what I talked to the company called Cryo about at one point too. And I think we agreed that actually it could be used in combination, but let's do it on a different day so that we don't create a quick change in temperature that could lead to an actual infection, because usually infections can attack us when there's a quick change in temperature. The body gets weakened a little bit. When you're stress is good to a certain level. Pushing the stress a little bit too hard can actually give you an opposite effect.
All right, so mainly don't push your body into too much stress. That would be the key message, right?
That's the key message. I wouldn't. So if you don't know what pushing your body, because there's a fine line between pushing your body versus I'm lazy, I don't want to do it today, right? There are a lot of devices out there that can help you assess whether you're straining your body too much. And you could always ask me later on what I use to see if I'm putting too much stress on my body. And that's one way. I actually wore all my devices in the whole body hypothermia machine too. Pretty interesting stuff that happened in there.
All right, thank you so much, Doctor, for answering the questions. Since there are no further questions here, I would like to conclude today's live sessions by hoping that everybody here found value in today's topic and that they could gain new perspective that could improve their overall quality of life as well as for their loved ones. And I would like to say thank you to Dr. Brian for coming to join us and share your knowledge. Is there anything else you want our audience to take away from today's live?
So I encourage you to actually look for ways to make your health better. I think the goal these days that I've noticed, a common theme is we're trying to prioritize health a lot more compared to before. We would prioritize our finances, which I do
Yes.
like that shift. And this is actually one way where you can actually help promote your health a little bit more, but do it in a safe way. If you don't know how, it's always great to ask questions. If you decide not to do it, that's great too. That's not a problem at all. But if you want to challenge yourself and see what it is, what happens during a fever, this is one of the greatest way to do that. And you'll see it. And I can guide you through too. Like, hey, look, you're spiking a fever. This is what happens when it happens. Your heart rate goes up, or does it go down? Does your blood pressure goes up, or does it go down? So it's a great learning experience, and it teaches you how to look after your body a lot better, and as well as people around you. So I just want to give that thought to everyone, and I hope everyone stays healthy and happy as always. Thank you for having me here.
Thank you so much, Doctor. ขอบคุณค่ะ Thank you so much. All right, and as Dr. Brian mentioned here that we need to take care of our health and prioritize our own health. So before we wrap up, it's now time for us to look into what we can do to make our body healthier. So right now we have a exclusive promotion that we're offering to you with our Pinktober Power for Prevention, with special offers listed down here. Namely are the ESP preventive cancer screening for you to take care of your health with comprehensive screening, and initial immune assessment to help strengthen your immunity for optimal health and wellness, as well as the ESP hyperthermia whole body for 5 sessions where you can embrace holistic healing and discover the benefits of whole body hyperthermia, which we have discussed this today. And lastly, when purchasing any wellness package, you will be receiving an incredible 10% discount on our IV program listed on the slide. So these exclusive offers are available for a limited time until the December 30th, 2023. So do not miss out on taking control of your own health with Esperance, where we are committed to supporting you with your preventive care journey. And if you want to learn more about these exclusive offers, please contact us via Line Esperance and take a step toward a healthier you. Or if you would like more information or consider any programs, please feel free to contact us with any questions or any concerns, or to schedule a consultation or treatment that meets your needs and preferences. And lastly, please make sure to follow Esperance all across our social media platforms to ensure that you don't miss out on any updates or details. And as we always say, we hope to see you again in the next coming sessions. Thank you very much for today. Have a great day, everyone. สวัสดีค่ะ